BioVie's blinded phase 3 data on NE3107 was presented at Clinical Trials on Alzheimer's Disease's annual meeting. And with me is the CEO to break this all down at BioVie. Cuong Do, great to have you here. Tell me about this data that was presented at the meeting.
Great to see you, Jane. Thank you so much for having me back. Our team presented our data yesterday, and there was some pretty phenomenal finding. Our phase 3 trial has been going on for quite some time now. We have finished that trial. So the team right now is busily cleaning up the data, verifying the data so that we can unblind and provide the final results later on this year. But as we go along, we have blinded data, right? So patient information for patients who are both on placebo and on drug. And we found 4 spectacular, surprising things, right? The first is that the blinded data suggests that NE3107 is biologically active, and it's having an impact on the cognitive, the biomarkers, and the imaging endpoints that we're looking at. So let me take the first one of those. So when it comes to cognition, we use scales such as ADAS-Cog or CDR-SB, MMSE. So these are scales that are used in the industry all the time. And what we're seeing is a scattering pattern, whereby many patients improve and then many more gets worse. Now that's encouraging because if the drug was not working, everybody would be clumped together, right? But the fact that we're seeing a scattering where some people get better, some people gets worse, suggests that there is something going on biologically, right? And then the other thing that's encouraging about that is what we see from one scale is correlated to what we see from other scales. Right, so it suggests to us it's not random. It is clearly something going on biologically with these patients.
Okay, it sounds like you've determined that it's working somehow. So what happens next then?
Well, what we are busily working on right now is to clean the data. And then later on this year, once all the data is cleaned, it's in the database, we will unblind the data. And when we unblind the data, we hope to show that those that are on drug perform better than those who are on placebo. And the thing that we're very, very focused on, there are 2 things that we're very excited and focused on. The first is the cognitive data that I just mentioned. The second is that we've presented some shocking, surprising data that showed that NE3107, just over 30 weeks of treatment, reduced the amyloid burden in the patients. There is a mechanistic explanation for this, but we did not expect to see it in such a short period of time. But in just 30 weeks, we saw that roughly 1/3 of the patients who were considered to be amyloid positive at the beginning of the study turned out to be amyloid negative at the end of the study. So that was really, really surprising, pleasantly surprised to see that.
Yeah, no, I mean, game-changing potentially, it sounds like. Yeah. Were there other things that you presented at this meeting?
The other thing we'll say is that it somewhat verifies the mechanism of action. We reduced inflammation, we reduced insulin resistance, and the drug remains to be very, very safe profile, right? So it's terrific. We cannot wait until after Thanksgiving to unblind the data.
Oh, and I really hope we can do a follow-up interview so we could get some more updated on this because it's been very exciting to watch this. Finally, what can investors expect next from BioVie?
The next step is really hopefully right after Thanksgiving is when we will unblind the data and we will provide the top line data result at that point in time. So we will issue a press release and hold a conference call to explain the data. So that's the next big catalyst.
Well, it sounds like I will be talking to you again later this year. So I look forward to that.
Looking forward to it as well. Good to see you, Jane.